Well, good evening, good afternoon, good morning. My name is Mark Monahan, and I'm with Aquacast Liner. I'd like to thank you all for joining us for our webinar, Why Waterproof Casting Can Be a Game Changer for Orthopedic Practices. Our featured speaker is Dr. Andrew Weiss from Southern California. The presentation is brief, about 15 to 20 minutes, and will be followed by your questions and answers. So please prepare any questions and send them via the chat room or the question box, and we'll do our best to get to them as soon as possible. Everyone who registered will automatically receive an email from Zoom with a link to the presentation. So we've had hundreds of registrations from all over the country and about a dozen different countries represented. And we've noticed that a large percentage of our attendees joined within the first couple of minutes. So I'll give the background of our featured speaker as they sign on to Zoom. A Los Angeles native, Dr. Weiss graduated from the Harvard School and then left Southern California to attend college and play soccer at the University of Pennsylvania. After graduating magna cum laude with a Bachelor of Arts degree in the biological basis of behavior, Dr. Weiss returned to Los Angeles and taught high school biology and algebra. He subsequently attended medical school at the University of California, Los Angeles School of Medicine, where he graduated with honors and then completed an orthopedic surgery residency at UCLA Harbor Medical Center. During his residency, Dr. Weiss had extensive exposure to general orthopedics as well as orthopedic trauma. Afterward, he completed a sports medicine fellowship at UCLA Medical Center, where he also served as the team physician for the UCLA football, volleyball, and baseball teams. In addition to his background in general orthopedics, orthopedic sports medicine, and orthopedic trauma, Dr. Weiss loves working with children, and you'll hear that firsthand. We are excited to have him join us this evening to share his perspective. And once again, please send any questions via the chat or question box. And now I'll turn it over to Dr. Weiss.
Thank you very much, Mark, for that introduction. It's always odd hearing someone talking about you, but I appreciate it. It reminds me how old I am. It's been a few years since I've been doing all that stuff. I was basically asked to give a talk about this material, this waterproof casting material, mainly because I order so much of it. And they asked me, they said, you know, do you like the product? And I said, of course I like it. It's what I consider a no-brainer in my practice. I've been using this now for since 1999, so 22 years. I've been using this product. When I was in training, you know, we had boxes of it, and then the company switched to a new vendor. This was when I was finishing up my residency, and because they were switching, we were worried we wouldn't have this stuff because we thought of it as gold. So all the boxes were kind of hoarded, and they were putting them away to make sure that we kept them and still had access to them. And then when I got out into private practice, I was very happy to find that it's back, and it's the same product, and it's been the same product for all these years. A little bit about my practice. Hey, Mark, can I get this thing that says the cursor that says leave meeting and continue on my?
Yeah, you're in pretty good shape. If you just hit the arrow, I think you should be fine.
I know, but there's this, it's just blocking the screen.
Okay, sorry about that.
I have this thing that says this webinar is being recorded, so I apologize. I don't know, are you able to do it?
I'm not.
All right, I'm going to ignore it. I can't. I don't have a cursor, so I can't. Oh, wait. Anyway, all right. We will deal. So I currently have a private practice in Beverly Hills, where I see about 50% of my practice is children, pediatrics, typically trauma, and the other half would be adults with injuries, including trauma and other sports-related types of injuries. I found my focus in pediatrics when I was in residency. We had a great deal of pediatric trauma come our way, and I learned a lot of the skills that I'm practicing today in terms of how to take care of children effectively. And those providers out there know what kind of skills make that successful. A lot of it is not just being able to communicate with the patient, but really being able to communicate with the owner of the veterinary patient, or the pet, which is the parent. And waterproof casting has been instrumental in appealing to both the parent and the child, and especially right now as summer's coming quick. I do both surgical and non-surgical practice of orthopedics, as pretty much any orthopedic surgeon does. And these are the topics that we're gonna talk about. This is more of a opportunity to meet a good old-fashioned practitioner, orthopedic surgeon who uses this in an everyday fashion. I am not, though I'm affiliated with an academic center, I am not doing things at a high-level tertiary referral type of center where I'm putting on 9 hip spicas a week or a month. I use it in my everyday practice. I use this in the adult population and the pediatric patient. I would say, and again, do I have the ability to put a non-waterproof cast? Absolutely. And could I? Yes. But the majority of the patients, probably greater than 95% of my patients, I use a waterproof cast. And then the issues are why. It's really, to me, instead of saying why, it's really why not. The advantages are numerous, and the disadvantages, I really don't think, I know that I'm not just trying to say all positives, and I'll try and come up with a negative if I can think of one, but I really can't come up with a reason not to. And I challenge people to tell me when and why you wouldn't. The skin health is absolutely, it is absolutely improved, I believe, with the ability to wash underneath the cast. So, and that also goes with hygiene, especially in this climate that we're in. We're asking people to constantly be washing their hands using the Purell, etc. And what's happening is people with non-waterproof casts that are doing such activities end up with getting water inside their cast, and as a result, and I was just this literally happened 2 days ago. I had a patient's mother call my office and say, "Do you do waterproof casts?" This was to my office, and the reason she was calling is because her child had a long arm cast that was not waterproof, applied at a major institution around here, and they did not do waterproof, and this kid got his hands wet, and it macerated the entire inside of his cast to the point where they went in there, cut off the palmar portion of the cast. And I don't know if I can share a screen, but I do have I have a picture of it, but just to kind of tell the truth here, and came in with this very large cast applied, and the mother was asking me, she said, "Can I do a waterproof cast?" I'm like, "Sure." She's like, "Really?" And I'm like, "Yeah." And then she's like, "And it can really get wet?" I go, "Yeah." And then she said, "Well, but don't I have to dry it? And how hard is it to maintain?" And I just kept going like a Honda commercial or something. "No problems, nothing to do. Just put it on and you're fine." So I really do believe this product is a game changer in that sense, that it gives the opportunity for these patients to be able to do whatever they want with regard to water, and essentially, when we're putting casts on pediatrics, as many of you know, we typically will say to the patient and to the parent on a pediatric that do whatever you can do in the cast, because we're assuming you're going to do it. If they're going to jump off of some ledge, then you got to put a cast on, maybe a long arm cast instead of a short, in order to prevent him from doing it. But really, we can safely just say, hey, you do what you can do in this cast. And that way it's kind of an including getting it wet. The one place, and I did think of one place that I do worry, and I live in Southern California, is I have patients, a lot of them that surf, and I do not want them getting sand in this cast, only because I worry that it would be difficult to remove. And so that being said, I have absolutely had surfers that have sand in their cast and just washed it out and didn't have an issue. But I will say, if you're going to be in the ocean, please stay, we're going to go with a non-waterproof and keep it, I'm sorry, we're going to go with the waterproof cast, but you got to stay out of the sand. Application tips. I think there's a lot of videos online. I mean, I've been doing it for so many years, 20 years. I put on all my own casts. I don't have a cast tech intentionally. That's my opportunity to basically connect with the patient and the mother or father. And we answer questions like, you don't need to worry about this. It goes on and everything's great, and etc. So I have many tips and I could share them. But let's see what the next slide shows here. So I thought in the vein of showing you why I do this, I would show patient interviews with some of these little guys and girls that I get to see. So why do I do this? I get lots of letters that are basically thanking me for what I get to do every day. And this is pretty much why I do everything in my field. And the waterproof cast just lets me shine. It really is one of those situations where the patient is so grateful. So that's why I do this. I'll show you a quick interview with a repeat offender who's broken her arm, had a waterproof cast, and then we got to do another cast on her, and she can tell you what she thought. So let's see. How do if I hit play, does that work?
It's a couple more down, so you can kind of skip over the next couple if you like. And skip that
then
one.
Well, yeah, here I'll oh, I see. Okay, so we'll get to that later. I'm still learning Zoom. I'm not that old, but yet I feel like I'm getting older and older as I see all this new technology. So this is an interesting slide that I wasn't even aware of about the history of this product, but I get asked all the time, how long has this been around? I'll have the parents will always tell you their experience, how they were in a cast for 9 months made out of, I don't know, cement or whatever. But the reality is this product has been around a long time. And it really has been unchanged. The original Gore Procell was what I remembered in my training. And then you can see it transition to the AquaCast label. And it's really been, an amazing product. So let's see, hygiene goes without saying. It really is a product that is designed for the modern day right now, where we're really concentrating on hygiene and spread of viral illness and all the other stuff that's out there. Application, I think this, as I'm putting these casts on, it is in a sense an art form, and I don't mean that in an arrogant way, but it is an art form. And as you can see, when you look at anyone's art, they're all different, and they all have different highlights, and they have different focuses. The unifying theme of quality art in this case is comfort. So what we need to do is make sure that the cast is as thin as possible to give a mobilization. So and then the other thing is protect the areas which are going to have issues. What are those? Anywhere at the margin of the cast. We want to make sure that we have the thumb base well padded. I like to cuff at the palm at the area of the metacarpophalangeal joint, so they can make sure they have flexion of fingers into palm, as well as at the forearm proximally and above elbow in the event of a long arm cast. Also, there's a lot of pictures here of arms, but the reality is this is used for legs as well. The one difference that I generally use when I have leg is because you can't put there's something called a zip stick, which is a safety stop, a plastic thing that slides down the cast in the arm. I put the tape. There's a tape that you can get that will go in the leg cast, especially a long leg cast, because you're not going to be able to slide anything down with the knee flexed. So I always remember to put I try to always remember to put the tape when I'm doing a leg cast. It's just hard around the ankle to get it. And then with regard to an arm cast, I would do a long arm cast. Sometimes I'll put some tape at the top around the elbow bend. So those are my tips. I would be honored to tell anyone or give them if they had a question about it. I can go into more specifics over tips, but it is something that you just practice. It seems to me there's no real, it's not a very different skill than doing a traditional cast with the same principles that apply, which is we really don't want a lot of padding unless you need to have padding. And so one of the nicest things about the Aqualiner is you really objectively know how many layers you're putting. You're putting, no more than 1 to 2 layers. And therefore you can have a very well molded cast. And, there's all kinds of studies that show that the amount of padding, the less is better at holding the reduction. So, and it honestly, the cast is much lighter when you don't have to use so much material. So that's that. It's funny that, this is a picture of orthopedic practices in my area, and there's probably, 15 red dots on here, which is so underestimating it because there's probably 15 red dots within 100 yards of me in the world I live in. So, anything to differentiate your practice. I don't even need to advertise that I do this. I really don't. I think word of mouth is enough in my life to have people come to my office specifically for this type of cast application, as was noted by what I was saying before, someone calling the office specifically asking for a waterproof cast. Patient satisfaction, I've mentioned it. This just kind of tells you that. Let's see.
One more.
We are here with Brooklyn, who is a repeat offender. Oops, you did it again. It's been 7 months since her last one, but that completely healed. She was in a long arm cast and it was waterproof, and that's what we're talking about. So, how was your experience in your waterproof cast? You got to go underwater, and when you got out of the water, was it soaking wet and yucky?
No, it was heavy.
It was heavy. But then how long before you felt like it wasn't yucky, heavy, and wet? Like minutes? Minutes. And would you want to have another one like that, a waterproof? Does it work well? Okay. So we're going to put a new one on. She has a little broken wrist. Right here. You can look at the x-ray. That's her little buckle fracture. And she's a pretty crazy active person, and hence has the ability to probably injure it again. So we decided not to put it in more of a splint, but put it into a cast. All right.
When I cast last time, the first cast, I had to put trash bags around. I'm psyched about having this cast.
So you're excited or no?
Yes.
Okay, good. Show your cast. All right, onward and upward. So she's they're all very cute. This is this is another little guy who brings Legos to me. I make Legos. I'm a big adult Lego fan since COVID began, and this is a little boy who also brings me Legos to show and tell. And
Did
here's
you
history.
enjoy your cast as much as a cast is enjoyable?
Yeah.
No pain. Okay. Were you able to do fun?
Yeah.
Like what?
I went swimming. I got to take a shower and a bath.
Was it really easy?
Yeah.
And super comfortable?
Yeah.
What did you think of it?
Oh my gosh. Well, I think it's a game changer to have a waterproof cast because we could take him swimming. We could obviously bathe him and not have to worry about, whatever would happen to a cast that isn't waterproof. It changes everything because he was so much happier being able to take showers and swim.
Ready to get that thing off and have your leg back?
Yeah.
All right.
Tight on there though, that you gotta real unready. Squeezing it open. Oh! Oh, wow.
Oh, right.
Your leg.
Let's touch my
Dun,
skin.
dun, dun.
So that oh wait, here. So you can see in that video that that's not a staged cast removal. That's his real leg. It pretty much, the skin looks perfectly healthy. I will say sometimes it'll have an imprint of the Gore-Tex liner, and they'll go as if when you fall asleep, really deep sleep, and you have wrinkles on your face from the pillow. But with the exception of that, there really doesn't seem to be too much as far as a residual cast issue from the cast application. I left this more or less. I thought the more important thing or valuable thing to those watching would be more of the questions and answers, because mine is not so much of an academic discussion as much as just a practical, anecdotal, real life scenario. So I open it to questions.
Did you?
No, that's great, Doctor. So I'll jump in. There's a bunch, and they hit a few different topics. One of the first ones that we saw was around applying. So do you have any concerns with applying waterproof casts on patients after their surgical splint is removed?
Excellent question. So that is the other scenario, in which case I do not use a waterproof cast. If I'm doing an open incision, and if I have pins in a patient following a surgery, I will not put them in a waterproof cast, mainly because I'm concerned about the wound, that I will not be able to see the wound. And so I want the thing sealed off, meaning I will put a bunch on a surgical incision. I'll put a bunch of bacitracin and Adaptec, and then put them in a non-waterproof cast. I'm doing it because I want to be conservative. The last thing I want to know is that they're getting itching and things, and that it's because water has been in there and created some type of infection, and that could have been avoided.
Right. That there were a few questions about open and closed reductions, and then the one I just mentioned. Then also, are there any other types of casts, whether it's long arm, short leg? You talked a little bit about those. Are there any other casts that you don't use the waterproof on? Like a box or ulnar gutter, anything like that?
Yeah, I wouldn't use a waterproof cast in a lot of the settings where I don't really like to use a non-waterproof cast. So for example, when you're doing a boxer fracture, I try everything I can not to put them in a cast. If in any way I can put them in one of those removable kind of cock-up splints. That being said, if I do a reduction on a boxer fracture, I will not put them in a waterproof cast because I use an outrigger in order to maintain the reduction. And you don't want the outrigger getting wet because it can fall apart. Now, I also like to put a bunch of moleskin around where that outrigger is, which is that alumifoil padded splint. But these are good questions because they're making me think of when I don't use waterproof casts. Like that would be a very unique situation where I would not use a waterproof cast. If I had done a closed reduction of a boxer's fracture, I would put them in a non-waterproof cast with an outrigger, and then I give them a bag to put over it, or you tell them to put a garbage bag over it.
Okay.
And I'm sorry, I apologize. And the other one is the hip spica. I didn't used to do hip spica casts with the waterproof, but the bottom line is they have a liner that is really unbelievable. And so when I got that, it just works so well. So I got the liner for the hip spica, and thank goodness I don't have to put hip spicas on that often. But I've done it on a couple, and it literally changes the world on these patients. Because these are kids that are the hygiene is a real issue in a hip spica. So I used to only do non-waterproof because I was intimidated by trying to do it with a waterproof cast. And then I started doing it. I've done a couple, and they worked amazing.
That's great to hear. I know when we do these, a lot of times people are very interested in the instructions that you give patients. I guess we'll go two directions. One, kind of a general instruction. What do you say to the patients? And then there's a few that get a little bit more specific, but what instructions do you give the patients when you're putting a waterproof cast on?
So it's funny, I give a FAQ sheet that has answers to the common questions. But as I had said before, as I was saying before, the reality is there really isn't much instruction other than the kind of obvious things. Don't pick apart your cast. Don't pull the liner out. If you can keep them from doing that. It can absolutely go underwater, submerge in the water. I tell them I don't want them getting it in the sand. If they do go in salt water, so if they go into the ocean and you go, how would that happen? Salt water, but no sand. If they went like diving, or they went on a boat, or they went off of a rocky beach, I'm cool with that. Just rinse with fresh water. I also will say the frequently asked stuff is, the big one is, how do you dry it? And there are other products on the market that I have tried to use that are waterproof cast material. And those ask you to take a hair dryer and blow it out. And that almost makes it's almost kind of an impediment to using it, because you don't always have a hair dryer available when you're getting it wet. This product, I don't tell them to do anything with a hair dryer because it just dries out. I don't see it. Now, I was asking Mark, about his product, because in LA, we're in a dry environment. So we don't have humidity as much. And so maybe we're blessed out here in many ways, but specifically with that, you don't need to dry it out because the air will dry it out. And in that case, maybe you would do a cold hair dryer, but not in my patients. And I actually, funny, I say to them, the biggest thing, the most important thing to do is get it wet, is make sure you submerge it, because then it cleans out whatever is going to start to try and grow in there. Let water run through it. Let soapy water run through it. I will every once in a while have a patient that just doesn't believe me, that they can't believe that you can get it wet, and they will come back with this cast that they have not put in water. They treated it like a non-waterproof or not a standard traditional cast. And it's kind of nasty, like a non-waterproof cast. It's got the skins all kind of mottled and peeled over, and you can pick it away. So I say get it wet, because there's no point in having it if you're not going to get it wet. And if they truly don't believe me, which is ridiculous, then we should just do a non-waterproof cast.
Oh, great answers. And then specifically, they were said, how do you tell the patient to dry out a long leg, specifically in the heel area? And we could add the elbow area. Is there anything specific that you suggest for those?
Well, so to be honest, I don't suggest anything. And then you say, well, with the elbow, I think water will drain out pretty easily. With regard to the heel, I still think water will drain out pretty easily. Obviously, dependently, you'd think that it could pool in that heel. But the worst case scenario, I mean, as you saw that kid that I just removed that cast, there's no heel maceration. I mean, there just isn't. So have I seen kind of waterlogged in some places? I have, but I've seen them as much in a non-waterproof as a waterproof, because they have sweat and they get kind of a different issue. So I don't think there's any reason, and I hope I can say that without missing something, that there's some major hygiene thing I'm missing, but I do not think you need to tell them instructions on drying out a long leg cast. I mean, and I'm talking hundreds of them I've done, and they don't have issues.
No, and that's a good point. We have actually a training seminar tomorrow where we're doing a long arm and a short leg. And one of the points that this particular trainer talks about is just kind of pointing the toes to the ground so the water drains, and lifting the long arm, if you will, lifting the long arm into this position or to this position where the water runs out pretty quickly. And I think that's something we've heard, but we can.
Are you saying, I'm sorry to interrupt you, but you're not saying that the foot should be in Aquinas when they put the cast on? No, you're just saying like put them in a prone position and let the toes point down. Okay.
Yeah, so lay on your and let the toes point out. Yes. So
yeah, we don't want to give instructions on how to put on a cast improperly. You need to put it in neutral, or you need to put it in whatever it is. I guess if it's some other. Okay.
All the basics still apply no matter what you're doing. And then another question popped in: do any patients return to your office because of tightness of the cast? I'm assuming specifically after swimming.
Specifically after swimming, absolutely not. I've never, not even a single time. Have I been called to my office has been called that the cast is too tight? All the time, but that's a cast issue. And one of the advantages is I can say on the phone, put the cast in cold water, decrease swelling. The reality is most of when people say cast is tight, a lot of people are just claustrophobic. They don't like the feeling of having, and this is even really a lot in the adult population that have already developed their anxiety disorders. But I apologize, but that they can, instead of telling them, you can tell them to elevate it, but you can also tell them to put it in cold water. And to be honest, it's nice because it gives them another outlet for how to manage it, because people don't necessarily want to just hold their arm above their head. And same with the foot, you can put it in cold water. And also, and that goes with, I didn't mention this, but the number one question anyone ever asks about a cast is, what do I do when it itches? With itching. And the reality is this is another avenue of what we can do. We absolutely don't want people throwing clothes hangers down the cast. We really want to avoid anything going into the cast. So this is the advantage of, they can let water run through the cast and it can help with itching. I think, I have not actually tried it, but at least I can say on the phone, try running water through it and it should help with itching.
No, it absolutely does help. There's no question about it. And I think that, the product it's one of the smoothest surface in the world. So it does help even reduce that to begin with. So there's a question regarding an issue that some folks are having. I'll just kind of read it out. And it has to do mostly with weight bearing casts. So they've had some patients that have been complained about the casts loosening up when they've used this padding. And there seemed to have been more significant problems when they had a patient in a weight-bearing cast. Do you have any application suggestions or techniques on how to prevent this from happening with weight-bearing casts?
Okay, well, fundamentally, a weight-bearing cast is going to have loosening because you're weight-bearing on it. So and it's funny, I think the reality is with a weight-bearing cast, we're not concerned about holding a reduction, for example. We're kind of putting them in a weight-bearing cast. My advice would be, if you're putting them in a weight-bearing cast, strongly consider putting them in a Cam Walker boot and not using a weight-bearing cast, because I think it's just better for the patient. Now, if you absolutely think that the indication is for a weight-bearing cast, I do think you can do extra padding, you can use extra material, but I just don't necessarily think that I'm trying to think if that would actually, sometimes when you have extra material, you swim a little more in a cast. So I think a tight fitting cast is useful. I think the biggest issue with weight bearing casts, in my experience, is that they just wear on the bottom. So I make sure I would give them a post-op shoe for a weight bearing cast, and that might alleviate some of that pressure on the bottom. And then I even give them a shoe on the other side, like, to even it up. There's a company that does that, so they don't have they're not off balance. I haven't had really though issues. And again, I don't want to sound like I don't have any problem with this thing, but I haven't had that experience where I've had problems with a loosening cast in a weight bearing setting.
No, those are all good points. I think Dr. One of our national trainers is going to be doing a presentation at noon Eastern time on this very subject. So we'll send out links to that after this, but it's one of the things that we've seen over the years is people don't use enough padding on the bottom of the cast. And so what she'll talk about is the number of layers and how to apply it. And we say, put more on the bottom and less kind of in the bends where you don't really necessarily need it. And so she'll go over some of those things.
Yeah, you when you're applying a roll, you don't be afraid or don't be shy to cut as you're applying the roll. So you're only applying one side. So you don't, when you're wrapping an ankle, don't keep putting as equal amounts of material on the anterior aspect of the ankle as you are in the heel, because the cast isn't going to fit well. But that's a cast application issue too. But this is very easy. It's sticky, so it literally will stick to itself. It's not going to fall off once you put a strap below the heel.
So, Doctor, as we talked about, as we're going through the videos, people are asking, you're starting at distal versus proximal versus distal. What is your take when you're doing a cast?
Okay, so the book answer is you're supposed to apply the cast from distal to proximal in order for swelling issues, right? Honestly, I understand that, but I don't do that, and that may probably, I hope that doesn't make it seem like I don't listen to evidence-based medicine. If it's an acutely swollen, I would be very careful to put them in a cast at all. I would be putting them in a splint and then converting them to a cast. So then why do I do it the way I do it? I like the cast I like to make sure I'm not putting extra fiberglass. So what I do is I will wrap 3 times around the cuff proximally, like for a forearm or at the elbow, and I will work my way up to the hand, essentially, so I know I have enough material, because the extra material, I don't want to lay it down up at the proximal portion of the cast. I'd rather lay it down into the hand and wrist. This is art. This is where it comes into art. I think everyone has their style. I think if I was training someone, I probably would say you should start at the hand and work your way towards the forearm. But this one has been very effective for me. And I will say, like, as people that apply casts may also realize, no two, they're like snowflakes. Everybody's different, a little bit different. So like everyone's hand shape is different. Everyone's the size of the hand, the wrist, the forearm. So they all kind of have different ways. I don't always go 6 turns to the right, 1 turn to the left, this. I do cut my fiberglass as I'm going around the thumb area because I can split the fiberglass and then fold it over in half, and it makes a really nice fiberglass cuff around the thumb without putting, again, the goal here is the least material possible to do what you're trying to do, which is give a comfortable cast, which is stabilizing the joint or the extremity.
Okay. And then
Long answer.
there was a couple questions around the saw stop tape, the blue tape or the white tape. Do you use that on every cast or just on the long leg casts, or where you're putting on?
I use it. Pretty much I only use it on long leg casts. And the reason I do that is because I cannot put the sliding stick into the long leg cast. You can't. There's two bends, and even on the short leg cast, it's hard to get around that ankle joint, and that's where you could end up scratching someone. So I put the tape on any lower extremity cast. On the upper extremity, I will occasionally, if the child is just really histrionic and just all over the place, and I know it's going to be challenging, just so I can go really fast. So I can take the cast off like that. I'll put the tape, because if you put that tape, you are not going to cut the patient. You're not going to scratch the patient, even if they're bucking, kicking, jumping, whatever, you're not going to. The sliding stick, the reason you don't need it for the elbow is because it usually casts are looser above the elbow. So you're able to cut almost with your hand in the cast, you can cut down to the elbow joint. And then I'm happy to explain why it's okay to have a looser cast up at the top above the elbow, is because the main issue is you're trying to prevent rotation of the forearm. And that, yeah, but anyway, that's a ortho stuff.
And then some folks are asking about, you have already addressed it, that you put on most of your casts, if not all of them. How long did it take you to really feel comfortable with the material? And just how long did it take you to learn it?
Honestly, it's been so long since I learned, and I probably learned from an amazing ortho tech back when I was in training, but I don't think everybody learns at different rates. I don't feel like it's hard. It's like asking me to remember how do you brush your teeth, or what was it like when you first remember to brush your teeth. I don't know. I would say this is not difficult. It is not difficult. Now, to make a good cast is difficult. I think it's an art. I think it's something that you practice and you learn basic skills. And I do think there are some people that are good and some people that aren't good. And if you walk around the street, you can see people's casts, and it's a big spectrum, what's out there. And so I just think if you're putting casts on, there's no difference as far as the learning curve of putting a waterproof cast versus a non-waterproof. The learning curve would be similar, in my opinion.
Yep. And then just something around the product specifically with waterproof casts. Are there any specific brands of casting tape that you prefer, and why?
I use the 3M fiberglass rolls. And I use multiple colors. The kids like that. I've tried other ones, and they don't work as well. I don't know why. Maybe it's because they start unpeeling at the end. I put it in the water for whatever in my brain is counting to two 1,000s. I squeeze. I know exactly how much water needs to go, the temperature of the water. It's perfectly made for my 3M fiberglass. So when I'm applying it, it's universal. That being said, I'm sure there are people that would say I want to use a different brand, and I think I intentionally don't look how much it costs, because I don't want it to ever to gear the way I'm practicing based on the cost, but I probably is more expensive to use the 3M.
Well, it works with every brand out there, so it's fine.
Yeah.
And then how do you determine the cost you charge the patient? And how do they react to it?
I I'm in an area, obviously, that is not is very unique. I mean, I'm in a high rent district, so you know we don't charge astronomic. I think it's something like $90 or so. I don't even necessarily do it. I try to stay out of the finance part of it, but I don't think we don't have much people ever say, oh, forget it. I don't want to pay that. Now, I don't want to ever assume that someone should be okay with paying $90 for a cast. But and I absolutely will say, if we don't want to if you don't want to do this material, I'm happy to do a non-waterproof. And there have been times that I've done that over the years, but it's really infrequent. And I think I'm fortunate to have a very a population that can pay for these things. It is not, it's not as cheap as a non-waterproof cast. There's no question, but the what you're giving the patients, if you ask the patients, they're saying it's priceless. They've never commented, I've never heard someone say, I can't believe I paid whatever, $90 or $60 for the waterproof material. I've never heard anyone complain ever. So once it's on, I think they realize how amazing it is.
Yeah, you mentioned earlier there was, you're in a hotspot for orthopedic surgeons, and
Yeah.
people come to you because you have waterproof casting. Do you still see that?
I'm sorry, what was the question? Meaning
that people still come to you because in that densely populated area, you have a lot of, or you offer waterproof casting.
Yeah, I mean, it was very interesting that I've never heard I haven't heard that where someone literally called to say, do you have the waterproof casting? My friends all told me you do. That's why we're here. We already were seen by another doctor. We want you to switch it. But I'm sure that's happening more often than not, that I'm just not necessarily aware of exactly how people come into my office. But yeah, it's not that I'm ever doing a waterproof cast because I'm trying to be like cutting edge. To me, this is standard. I mean, I do believe this should be standard practice. If, again, given the parameters of when you're using it is appropriate, and that it's cost effective for everybody, for the patient, for the practitioner, etc.
Okay. Well, awesome. Dr. Weiss, thank you so much for joining us. Some great questions. And on behalf of all the folks who have joined us this evening, thank you. Just a reminder, you'll be getting an automatic email from Zoom that will have a link to the presentation. And if you have any questions, please visit our website at aquacast.com. And we'll send out, there were a number of questions about application techniques. We'll send out a link to all the attendees for a seminar that's going on tomorrow that we'll get out to everybody. But Dr. Weiss, again, thank you so much for joining us, and thank you everybody for joining us. Have a great night.
Thank you.
Bye-bye.